Hello everyone, my name is Favor Esomune. I'm here to discuss an event I read online that's bordering on bioethical issues that are affecting healthcare practice. The author of that article, Mr. Goodis, in 2021 presented a case titled Patient's Autonomy in an End-of-Life Care is a True COVID-19 Story. The author was a healthcare provider who received a call from a patient that was in severe respiratory distress. That patient also had a history of asthma and emphysema. The patient refused to call 911 because she said they will not allow her husband in the ambulance with her. The author, in a bid to helping that patient, promised the patient that he would speak to the emergency response team to allow the husband in the ambulance, but he never did. There are two ethical principles discussed in that story. Number one is the ethics of patients' autonomy. Patients have a right to the kind of care they receive. Number two is the ethics of beneficence. As healthcare providers, we are expected to provide the care that are not harmful to the patients. These two ethics are embedded in the code of nursing practice, and every nurse is expected to obey, respect those codes of nursing practice. In Code of Nursing Practice Provision 1.4, it states that patients have a right to self-determination. They have a right to the kind of care they get. They even have a right to refusing care. That's their choice. And healthcare providers like nurses were expected to respect patients' rights, their wishes and choices. However, in Code of Nursing Practice Provision 4 states that nurses should practice with the best judgment according to the state regulation and organizational policies as stated by Purdue Global in 2025. The author violated the patient's right to autonomy. However, respected the code of ethics of beneficence, which was to do no harm to that patient. There are three things to discuss in that story. Number one, was the author right to have disrespected the patient's autonomy? Number two, what are the ethical and legal implications of such a violation? And number three, what are the recommendations in such scenarios? Number one, the author violated the patient's autonomy but respected the code of beneficence because he knew that if he had delayed, maybe the patient would have entered in respiratory failure, which would have been detrimental to her survival, or even would have died from hypoxia. So the author chose in his own right sense of judgment to go for the ethics of beneficence by sending the ambulance. However, there are ethical and legal implications to such violation. The person can sue. The patient has a right to sue because her rights were violated. And then ethically, we are expected to respect patients' rights because it leads to respecting patients' dignity and brings a lot of trust on the patient. So violating those rights was not good, but in such a dilemma where the patient's life was at stake, there's need for balance. And that is why it's recommended that there's the need for shared decision making through an open and an honest communication between healthcare providers and their clients. Nurses are expected to continuously advocate for an open and honest communication between healthcare providers and their patients. Patients should be told their treatment modalities, the side effects of the treatment options, or any alternative to treatment. And that way they have the right information, all the information needed to arrive at a good decision. As nurses, we must continually advocate that patients be told the truth. There should be an open and an honest communication. That way, such ethical dilemma could be resolved or even brought to the barest minimum. Thank you.